Hi, I'm Dr. Melanie Palm from Art of Skin MD in San Diego, California, and today I just wanted to show you a short little video demonstrating Sculptra for use on the chest. So if we're actually gonna zero down to the chest so you can actually take a look. And what happens with the chest over time is we lose a little bit of the collagen support. The tissues become a little thinner, and women will often complain that when they wake up in the morning, they start to get a little vertical line or several of them in the décolletage area. So we're going to inject this V area of the neck with a little bit of Sculptra, which is polylactic acid, and it's a milk sugar, and it gets diluted away over time, but in its place it builds collagen, so it thickens up that skin and it helps improve the overall skin texture and the appearance to the décolletage area. So I'm actually going to start on our patient just over here, and we're going to work our way over. When we do Sculptra in the décolletage area, so I'm going to do a teeny little pinch, 1, 2, 3, I'm sorry. We actually use it a little bit more diluted than when we're doing it for full facial volumizing. So, dilution normally for Sculptra for me, if I'm using it on the face, is about 10 cc's or 10 mLs for using an entire vial of Sculptra. When we're actually using it on the chest, many of us that use it for chest rejuvenation actually dilute it down to about 15 to 16 cc's of liquid volume for the vial of Sculptra. And so this allows us to cover a larger area, to do a lower density, and it's really nice for building up the volume of that chest area. And it really just takes a couple minutes to do. I actually pre-incorporate a little bit of local numbing into this area. So as I work down, I go through an area that I've already numbed, which usually you feel a little poke, but isn't too bad. I'm already 3/5 done. Our patient is doing awesome. I'm going to reload for a second, and we're going to finish up with our 4th of our 5th syringes that we're doing of this one vial of Sculptra. And patients, typically, they can get a little pinpoint bruise. There are some little vessels that are actually in the chest area. So if one of those are actually captured when we're doing the injection, then occasionally you can get a little pinpoint bruise. Usually people are not really sore. It is possible, and the typical sort of dosing that I do for this is 1 vial of the Sculptra once monthly, about 3 times. And then I usually recommend for patients about once a year, once every year and a half. If you can do a vial, I think that keeps you in a better place. And we're starting to use Sculptra in more areas than the face. So there's some thought that it may help with building volume in areas where there's been scars, and that's it. You did awesome. And in areas that we want to build a little bit of volume back, and it may even help improve skin texture. So some people are looking at it in areas such as the arm, which we sometimes inject, and even in the legs for areas of skin laxity. So afterwards we do a little massage. The patient can be a teeny bit sore, but really this is a no downtime procedure. If you have questions about using Sculptra off the face or in the décolletage area, you can give us a call. Dr. Melanie Palm at Art of Skin, and our phone number is 858-792-7546.